The information shared on this podcast is for general educational purposes only and reflects the host's personal views and experiences. It does not constitute medical, legal, or financial advice, and no professional relationship is formed by listening to this podcast. As always, consult your own qualified advisors regarding your specific needs and practice. Thank you.
Welcome to But Seriously, a physician and a patient talk crap.
I'm Dr. Caroline Soyka.
I'm Sonia Narang. Today we're going to be talking about something that is near and dear to my bum, colonoscopies. So,
I love it.
Super excited. As a frequent flyer in the GI lab with colonoscopies, I think as an IBD patient, I go once, twice, at least every 2 years, at least. And I'm really interested in learning about what it is, why it is, what do we do, the prep, heads up. We're going to be talking a lot about the prep. And my favorite part is when you snatch the polyp. So let's talk about colonoscopies are important. Chadwick Boseman, Wakanda forever, passed away from colon cancer. Who's the other dude you said, Dr. Soika?
The guy from Dawson's Creek.
Yes, may they both rest in peace. They both passed away from colon cancer. So first tell us, why do you think it's on the rise?
If I knew that answer, I would probably be out of a job because, that's what I do all day, every day. Colon cancer is so common right now. I think the current stats, somewhere between around 1 in 25 people are going to get diagnosed with colon cancer in their lifetime. And the biggest surge that we're seeing is in the younger population. So we're seeing a huge surge in those under 45 or under 50. So it's now the number one leading cause of cancer death in people under the age of 45. So it's really important to get screened. And I tell people, the guidelines used to say start at 50. Now the guidelines say start at 45 and 40 if you have any family history. So family history of colon cancer, obviously, but it also includes people with family history of polyps. Like if your parents had polyps, technically you should start getting screened at 40. And I tell people, all colon cancer comes from polyps. The reverse is not true. Not all polyps are slated to turn into colon cancer, but we don't know necessarily, when we remove a polyp, which one was going to eventually go down that path. And I tell people, if your parents were diligent and got their colonoscopies and had a bunch of polyps, it's likely that if they were not diligent, they would have developed colon cancer, right? So we're excluding that group, but they should be included under the risk of colon cancer. So anyway, 40 years old.
Couple of questions. Can you define what a polyp is? And then I have a comment about our parents. But what is a polyp?
Yeah. So a polyp is a growth in the colon that is what we define as precancerous. Under the microscope, it's what we call an adenoma, which is basically abnormal cells that could potentially start turning into cancer cells down the line. So there's this thing called dysplasia, which is when cell nuclei start morphing into abnormal cells. And all polyps, technically, colon polyps are technically, for the most part, have low-grade dysplasia. And then that's what an adenoma is. And then they start kind of turning into high-grade dysplasia. And that's when we really know they're on their way to becoming a cancer.
So it's a growth inside the lining of your colon?
Yep. And there's multiple different kinds. So we can get into that if you want now, or we can touch on it later, but there's all these different kinds of polyps. And I think people ask me a lot about that. So I definitely want to touch base on that.
When you mentioned our parents, I was having this conversation with the parental units, and they said most of our parents, a lot of them are immigrants, they don't even have the right time of date of when they were born in the homeland because it was all midwives and no birth certificates. And people would die in the family, but we didn't always have access to preventative care. And even getting a colon, they're like, why do you, even though a lot of Indians are doctors, they're like, why do you need to go to the doctor, right? So it's not promoted. What do you think is the like culprit? Like, what if you had a pinpoint? Why do you think it's on the rise within the youth right now, like the
Oh,
40 to
you
50?
wanted to circle back to that, huh? You're gonna nail me
Yeah.
to the wall on that one?
Not nail you to the wall, but just curious. Like, I heard different things. I was at a conference this week. Some people said it's a diet. Like, for me, people said it's epigenetic. It might be because when we came from the homeland to America, there was something that my immune system couldn't adjust. It's the gut microbe. Like, just top three hypotheses you think.
I mean, I think the biggest hypothesis is processed foods.
Yeah,
There's chemicals and we don't know what they do long term, microplastics. Um, Ingesting these things with time probably changes some sort of chemical reaction or propensity to developing cancer, maybe. I don't know. I wish I knew the answer to that, and even still, like, I mean, I see patients who are vegan and, do an amazing job eating a vegan, natural diet,
clean. Yeah.
clean, and have focused on that for decades, and they get colon cancer. I don't know why. I don't know. I wish I knew, because, it's obviously an epidemic. But I think the one thing I can focus on with patients is preventing it.
Yeah.
And we know that colonoscopy is the only preventative test for colon cancer. And so I really feel very strongly that everybody should be getting their colonoscopies and getting them with whatever frequency. And whenever I'm counseling patients in recovery, if I tell them, oh, you had a polyp and whatever, like, well, what can I do to prevent it, Dr. Soyka? What can I do to prevent colon cancer? What can I do? And I said, the best thing you can do is show up when I tell you to
Yeah.
show up. If I
Yeah.
say get another colonoscopy in 3 years, that's the best thing you can do. Like, I will take it, I'll deal with it, right? I'll tell you when to come, and I'm not going to let you get colon cancer as long as you just do come back and get your colonoscopies.
Yeah, I actually, I mean, I don't look, well, one, I love Dr. Von Thala. I like going to my physician because she's wonderful. But that sleep that I'm put in is like the best.
The
It's
best.
like a 20 or 30-minute procedure minus the prep. How long is it usually so we can educate people?
Yeah, it's about 20 to 30 minutes.
Yeah. And they put you in these great warm socks and a blanket, and then they get the IV going. The anesthesiologist comes and talks to you. The doctor says hi, and you're out. Like, and then you wake up with a picture of your colon on camera, and like and now they have it in color, so you can see your colon if it's pink, if you got pimples on it, or like growths and all this stuff. And sorry, I just call them pimples because I'm like, what the hell is that? So you mentioned that there are different types. I think we talked about before mushrooms.
Mushrooms. Yeah, you like it. Mushrooms and
Mushrooms.
carpets.
Yeah, let's talk about.
So yeah,
I've never done mushrooms, Doctor Soika. So
I'm
that's the
not going to
closest I'll
comment
get
on
to.
that,
Yeah.
on my mushroom usage over the years. But suffice it to say, I'm not a current mushroom user.
Okay.
Um, but there's a couple types. So there's something called a tubular adenoma, which is this sort of like classic a pedunculated tubular adenoma, which looks like a mushroom. It's like a stalk, and then there's a polyp on the top of it. And in the stalk is the vessels actually that feed the polyp and its growth. So those
Ooh.
are actually like the easiest to take out, because if you put the little snare over the stalk that you're going to get a good margin, you have no problem. Sometimes you have to like burn it a little bit because there's a nice big old artery in there, but then you like pop it out and we suck it out. And then there's like flat polyps, and you can have a tubular adenoma that's flat, but if they're on the right side, generally they are called sessile serrated adenomas. We abbreviate it SSA, and those are tricky. Those are hard to
Because
see.
there's no stock.
There's no stalk, and they're very flat. I can share a graphic, of sort of the different appearance, but they're very easy to miss because it almost looks like the colon mucosa is here, and then it's like a little bit of an area of like snake skin. And you're
Oh,
like, wait, was that something? And many times it's something, and it can be even a lot bigger than what you first saw. So they very, very subtle, more common, much, much more common on the right than on the left side of the colon, more common in women than men, actually. And it's why I'm so militant when I talk to my patients about good quality prep, because they're the most commonly missed polyps. And if you don't have a great prep, I don't feel confident that, I didn't miss anything, especially those kind.
I'll never think of Aladdin's magic carpet ride the same anymore after this conversation. Let me just, because I know you and I are
It's
both like big
it's so
fans of the
funny, like,
mask.
we always like everything in medicine is like so descriptive, and we have to have like so many, like when in our drop down bars, when we write these notes, it's like, how would you describe the polyp? Would you describe it as fungating, villous, carpet like? I mean, everything is like, it has to be so many names: polypoid, nodular, deprat. I mean, everything has descriptions. We
Willis
love
sounds like I
description.
have a villain in my like colon. Like, what's
Villus is
going on?
like, it looks like kind of almost like grains of rice, like little villi are like little tiny finger-like projections. And
Yeah.
so villus adenomas kind of look like bumpy. Like, remember, I'm a child of the late 80s, 90s. Do you remember like that pin thing where you would like stick your hand on it
Yeah.
and then you would flip it upside down and it would make your hand print?
Imprint.
So those, like, you
Oh,
remember those?
yeah.
It was like the little pin needle things, and you would like
Yes.
stick and I used to put on my face, like, look at my nose.
So for those tougher non-stem ones, do you just like finely slice it like, like chefs
Uh,
do with some fillets? How do you do it?
so usually almost everything we do is snared. And a snare is like a metal lasso, very flexible metal lasso, and there's all these different kinds of them, stiff ones, large ones, flexible ones, and we kind of know what to use. But basically, you use like the pressure. So it's like you open up this lasso and you lay it over the polyp, and then you squeeze the lasso close, and it like, strangulates it until it pops off.
So you're literally like popping a zit with your Wonder Woman lasso, and
Correct.
it's
Except the
that.
zit is not just popping, the whole dang thing is coming off.
And then does my skin does the lining like heal by
Yeah,
itself? Does it take time?
very quickly. The colon is a remarkably, it bounces back remarkably fast. So if I took a polyp out and, I wanted to go back in and look at the site, probably wouldn't be able to know where it was unless I used like heat or cautery or burned or anything like that.
Oh,
I probably wouldn't even be able to know for like after like a week.
okay. Okay. And then you like lasso it, then you take it out of me, and then you put it in a little plastic box and send it for testing.
Not like a specimen container, like a
Yeah, that's
specimen
it.
cup. And yeah, and then we send it to the lab, and then there's a pathologist, and they look at every polyp underneath the microscope or every sample, and they're looking to make sure, does it have any of that high grade dysplasia or any cancer cells in it? What kind of polyp is it? There are benign polyps too. Sometimes we take something out where we're not sure if this is a precancerous polyp or something we call hyperplastic, which is like, I describe it to people like, you can have a freckle and you can have a mole, right? And sometimes you don't know. So
Yeah.
you take what you think could be concerning, but if it's just a freckle, it's a hyperplastic polyp. Like, it's never ever would have never ever turned into cancer. But sometimes if we don't know, we're gonna take it, right?
Okay. So it goes for testing, and then because on my notes I usually get a picture of my colon, And then, but I mean, we'll talk about prep, but I'm pretty drugged up. Um, I mean, that sleep is awesome. And then they come and they talk to me and they say they got polyps, and then I get my results in a post. Like we have a video conversation after to say what's going on in there and what activity there is. Um, and I know maybe it'll be helpful if we just have a discussion during a different episode on the colors of the colon, because I know there's like
Hmm.
pink and like, yeah, let's do a whole episode on the colors of the colon because they would
I
be
don't
like,
think we could fill a whole episode. I mean, for the most part, it's pink.
but mine wasn't pink as an IBD patient, so
Yes.
I
So
had
you
other
can
stuff, fun
you
stuff.
can get like scarring and pseudo polyps and redness and ulcers, but for the most part, the colon is pink. I mean, it can sometimes be brown, which we call
Yeah.
melanosis, and that's usually from chronic laxative use.
Mm.
But it doesn't impart anything. Like if I see a very, what we would call melanosis coli, if I see a bunch of melanosis coli in the colon, I comment on it, but it doesn't necessarily mean anything. It's not like it's going to increase your risk of cancer or colitis or anything like that. It's just dark. It just stains the colon.
Okay. So, color of the colon, you want it the pinker the better, like bubble gum, pink bubble gum. Remember
Yes.
those Hubba Bubba bubble gums that we had in
Oh,
the
yeah.
80s?
I
Yeah.
loved bubble gum or bubble tape.
Oh yeah, I
Yeah.
forgot about that. Or the
Oh my
Bigfoot
God.
ice cream with the pink and
Oh, or like, do you remember Big League Chew? It came
yeah,
in
yeah,
like that,
yeah.
and it
Oh
was
my
like
God.
tobacco. Yeah.
Fake tobacco. Oh my
That was
God.
like the only reason I went to my brother's baseball games was because they had like a snack stand, and then my parents would let me get Big League Chew.
Yeah, Dr. Ha would always be like, we want it pink. We want it like bouncy. Like we want it, and I never knew what I was looking at, but I just remember saying you want it pink. So before we go into prep and the whole procedure, I've been hearing a lot about Cologuard. Cologuard. Can you help me to understand what it is?
Yeah. So there's Cologuard, and now there's also another test called Shield, which is a blood test that purports to do the same thing that Cologuard does in the blood. And what those tests are looking at is abnormal fecal DNA. And so, like we sort of talked about how the polyp's nuclei are change or the colon's nuclei in the polyp is changing into what we call dysplasia or abnormal cells. They can what it's trying to do is detect that, so that dysplastic or even malignant cells basically that are shedding off into the lining of the colon. And Cologuard is actually really pretty good at detecting colon cancer. Like
What
I
is
think
it? I just poop into it? What is
yeah,
it?
it's like a box that they send and they give you like this little sample container and you poop into it and then you send it back in the box. Um, so it's kind of weird, but I tell people like if you want to know if you have colon cancer, Cologuard's a really pretty good test, like more than 95% sensitive for that. That being said, the two cons of Cologuard are one, ton of false positives.
Mm.
So many false positives. And two, it's really, really bad at detecting polyps. So we just spent all this time talking about polyps and precancer and all this stuff. Cologuard really doesn't find them, nor does Shield. It's not what it's intended to do. And I tell people, like, if it was me,
Mm.
I would want to prevent colon cancer, right? Like, I don't want to know if I have it. I want someone to take the polyps out before it gets to colon cancer.
Yep.
Like, why are we waiting? So I think they're two very different tests, and I think if people understand the role of them and they choose Cologuard, then that's fine. As long as we're educating people on what the different tests do.
Okay. So it's a good, nice to have. Double it up with getting your screening after the age of 45, or unless you have a history of
Well,
polyps and colon cancer.
unfortunately, in this country, our decisions are all dictated by insurance.
Insurance.
And so they either want you to do Cologuard every 3 years or you can choose the colonoscopy route.
Okay. I just have a bone to pick with so I get calprotectant, which is if you have an IBD or I don't know
Mm-hmm.
what the qualifications are, they give you this specimen. And I had to come up with a whole procedure of how I collect. You know, when you change a baby's diaper, it's really cute. It's adorable. Like, this is cute. They're so damn cute. When my granny had Alzheimer's, we were changing her diapers, and I was like, right, this is my grandma. She cleaned my diaper. I can do this. When it comes to your own, like, poop collection, it's a little it's a little fascinating, right? Because they give you, first of all, I feel like I'm in walking the like walk of shame. I get my cow protectant in this plastic box, and then they give me a spatula, like the ice cream sticks, and then they give me gloves. Sometimes I get gloves. And then they give me this brown paper
Mm-hmm.
bag.
The brown paper bag of
And
shame.
I have a friend who calls it the shit kit. But it's like, can
Oh my
you
God, that is an incredible name.
yeah, they call it the shit kit. And what I would like to anyone listening out there is like make me feel a little bit more empowered when I'm like make it sexy. Like give me that brown bag that you get like at Bloomies or a tote or Prada or Chanel or attach a Labubu, like incentivize me in some way, shape, or form. Like just make it a little bit more fun. And when you're going to gather your poop for your shit kit, like plug your nose, get your gloves on, make sure you're okay. Like it's high performance anxiety stress because I know Dr. Bonthal is going to be like checking my numbers and then telling me if I'm inflamed or not because it's assessing the inflammation in the mucosal lining. But please make it more fun for me. Like give me a treat. Incentivize me in some way, shape, or form. But that is just my bone to pick with
I'll
the,
have to we'll take that up with the administration.
yeah, like, put a Shohei Ohtani on it for Los Angeles
Oh my
Dodgers and,
God.
like nail it in the mitt or something like that. But okay, so we talked about Cologuard. Aim is to find colon cancer and prevention. Okay, let's talk about prep. Okay, so a lot of like I mentioned, I'm a frequent flyer. I have my preferences now on how
Mm-hmm.
I want to roll with it. But when you first get that notice that you need to get a colonoscopy, let's talk through the different prep. So heads up, you have to like excavate your gut. Is that the right way to say it? Like you have to clean your gut out.
Yeah, I mean it's gotta be like completely clean, no poop at all. And people are like, I feel like, how could I have anything left? I was having like diarrhea. And I'm like, no, it needs to be coming out literally like water, like literal clear water. If you're having any like residue and poop residue, that's not clear because we really need it to be clear like water in order to get a good view.
So let's walk through the prep. The week of, like, if your colonoscopy is on Friday, I think the new thing is like have a low fiber diet, no
Yep.
nuts. What else?
So
If
I
my
am
scope is Friday, what's my prep?
so I tell people 3 to 4 days before.
Okay.
And sometimes I tell them longer, like if they have chronic constipation or issues, or they have a very, very high fiber diet traditionally. You know, fiber is incredible. I think we might have touched on it in the first
Yeah, we did.
episode, but I call it like the Roomba of the colon. And it just like bang, it sticks around, it just bangs into the walls, it doesn't know what it's doing. And it's just meant to like be there for a long time to just like gather up everything and bulk it, which is great normally. It's like a cleaner, except for when you're trying to clean everything out. You don't need something that's going to be sticking around, right? So the less fiber that you have, people think like, oh, fiber is supposed to make me poop. Yeah, it's supposed to bulk your stool and help with evacuation, but it's not in this setting, it's actually putting you behind the eight ball. So I tell people like lower fiber diet for longer is really going to help you get a good quality prep. And fiber with things like nuts,
Yeah.
seeds, any like bran, um, vegetables, so like raw vegetables, skins on fruits, that kind of a thing. I like to tell people this story. I tell people like if it's something that a 3-year-old would eat, it's probably low fiber, right? I mean, mac and cheese, mashed
Waffles.
potatoes, French fries, waffles,
Yeah.
eggs. But I told this person one time, like pasta, like pasta's low fiber.
Yeah.
And I guess she was on a diet and she was trying to follow the rules. And there's this thing called shirataki noodles, which are like cellulose, which is only fiber. Okay,
Oh,
it's like literally celery, like the stringy part of celery. So it has like no calories. It's like calorie-free pasta, which it's no calories because it's just like strings and strings of fiber. And so she ate like only that for 3 to 4 days before.
ooh.
And so when she came in, she's like, I think I have a worm. Like, I don't know what's happening. Like, I don't know. And I get in there and it's like a sea of what looks like worms. And I'm like, oh my God, she's infested. And then I realized she was eating like these noodles. And there was just her whole colon was filled
High
like to
fiber
the brim
noodles.
with just high fiber noodles. Although it looked like
Yeah.
spider webs. And I was like, okay, I can't see anything except for noodles. You've got a colon filled with noodles. So anyway,
Monday,
don't
Tuesday,
don't
low.
use the substitutes is my point. Just
Okay.
regular old pasta.
Monday, Tuesday, Wednesday, low fiber diet, no nuts, no seeds, and then um, uh, prep day. Now, there's two types of prep. Dr. Ha introduced me to. One is well, we
There's
don't
a
even
lot of
mention
types of
it,
preps.
but my favorite is Marilax and Gatorade, and the whole point of Marilax and Gatorade is to wipe my gut clean.
Yeah.
And you time it, and you have, I forget which pill, laxatives. I'm supposed to have laxatives and Vaseline on hand because this is where we keep saying we need a bum facial. Like your bum gets a little angry, to
Yeah.
put
I mean,
it.
I think here's where a lot of, gastroenterologists, everybody has their own little like
Yep.
recipe. So I'm not going to like speak for everybody. In my practice, if you're getting a scope on Friday, I allow people to have breakfast on Thursday as long as it's low fiber. So I think
Oh,
I think that's sort of becoming the new norm, but I allow people to have breakfast and I say breakfast is defined as 24 hours before your procedure time. So if you're Friday at noon, you can actually eat in my book until like 11 a.m.
oh,
on
nice.
Thursday. And then again, that's my practice. Read the instructions from your doctors, but that's what we do. And then it's clear liquids after that. So that's things like chicken broth, popsicles, lemon ice, black coffee, lemonade, iced tea, jello, just nothing red because it could look like blood. Um,
Wait, is that why I'm not allowed to have red jello or anything red? Because it
yeah,
looks like blood?
yep.
Because I'll eat jello, but I get red and green. I just won't get anything red. I
Yeah,
mean,
it
no,
looks,
yellow and green or orange, just no red.
yeah, red could look like blood to us. So we think something's bleeding.
Okay, so you start the prep on Thursday to excavate your system.
Right. So I think
Um,
different practices, again, this is still another like practice specific thing. I think the majority of gastroenterologists these days are doing what's called split prep. And
ooh,
so um, you drink half of the solution around 5 p.m. the evening before, and then the next half, and we can talk about what the different preps are in the next in minute, but and then in our practice, we would say 6 hours before your scheduled procedure time, you wake up and drink the other half. So if you're at
okay.
8 a.m., you wake up at 2 in the morning and drink the second half, right? People get very worked up about that. And I tell people, one, this is for your benefit. It decreases nausea and vomiting, it increases tolerance, it does allow some sleep, it's much less cramping, but also it's for your benefit because it leads to much better quality preps. And we, especially on that right side I was talking about, those big flat polyps, when you do a later or your prep closer to the timing, it helps clean out that right side and flush it out. So it
Hmm.
is important to split it. And then let's talk a little bit about the different types. So you
Yeah,
mentioned,
so what I appreciated was Dr. Ha actually did it on herself and did both preps.
Yeah.
and then decided this is what she's going to do. Well, I love it when physicians experiment on self and then like tell us like, dude, I'm in the boat with you. So that's when she said Mira likes Gatorade all the way. So tell me about the different preps.
I agree. I have tried all of them. Because I
Thank you
find
for taking one
when
for the
they,
team.
yeah, it's one for science. I actually one time, like years ago, I was with a nurse practitioner in the hospital, and the patient was like refusing to drink the prep, saying it tasted so bad and this, that. And I just went in the room and like chugged a cup. And I was like, really? You can't do that? And my nurse practitioner was looking at me like I had 85 eyeballs. She could not believe I just drank an entire cup of laxative to prove a point. But I will do it. I will prove my point one way or another.
I believe it.
Um, but anyway, so there's multiple preps. Okay, so Miralax and Gatorade. I'm going to be honest with you. Not everybody uses it again, because it's off label, and technically there are possible
Wait, what does that
risks.
mean?
It's not prescribed by,
Oh,
it's not approved by the FDA as a prep for colonoscopy. That being said, I use it all the time. I think it's very safe, but there have been reports of electrolyte disturbances and kidney problems, and it's not a prep for everybody, especially people with heart disease and kidney problems. So, yes, it is something that a lot of us use, but it's not an option for everybody, and that's okay. So, some of the other options are these days, I particularly love to prescribe, especially if insurance covers it, the small volume preps. So
small volume.
they're much smaller. So one is called Clenpick. There's a couple other ones, but they're very small volume. So remember how I said like 5 p.m. and then 6 hours before?
Yeah,
So
yeah.
all it is at each one of those is 1 8-ounce cup of prep followed by water.
Oh,
So
that's it? Eight
that's it.
ounces and 8 ounces during the split?
Yep, and then you have to drink a bunch of cups of water, but that's the only
How does it
laxative that you have to
taste?
drink. I mean, I think it tastes fine. It tastes like very kind of like faint citrus with a little salt. It's really not as bad as like some of the others, like Suprep, which is one we use a lot. Go Lightly. They're very, very salty because salinity is
Mm.
obviously important when you are talking about prep because you want to make sure that you're not dehydrating somebody from an electrolyte standpoint. So they all kind of taste a little salty, except for Miralax because it's using, I mean, Miralax Gatorade because the Gatorade
Yeah, yeah.
has the electrolytes. But anyway, they all kind of have some salinity taste to them. But I like that. There's also, there's a bunch of other ones. There's Suprep, there's Plenview, there's Go Lightly, there's generic Suprep now. But all of them are kind of, the same idea. And then there's something called Sutab, which is
Mm.
pills, which is essentially the prep that they put in like gel caps. Sutab works well, but there are a bunch of caveats, okay? It's super, super nauseating if you take it too fast and
Mm.
just in general. There are a lot of pills. It's 24. So 12 pills at the 5 p.m. and
Oh,
then 12 pills then. And I tell people you have to take them like at least 3 minutes apart from one another. So, like, set a timer on your phone and take one pill and then wait 3 minutes and then another pill and wait 3 minutes. Otherwise, you're going to throw them all up
so you're gonna
and
pay,
then
you gotta pace
you got to
yourself.
pace yourself.
Okay.
And I usually prescribe them with an anti-nausea med. And they're not good for patients that have chronic constipation. So if you have chronic constipation or if you have gastroparesis or like a slow stomach, don't pills are not going to be an option for you.
Okay. Thank you for explaining all that. That's super helpful. Then when you're like when you're on the royal throne and you're excavating your system, like we're big fans of Toto's or any type of bidet that helps fluff the bum, Vaseline, any other tips for all of the pressure, literally no pun intended, that's on your bum.
I mean, I think don't sit on the toilet too long. The longer
Yeah.
you sit on the toilet, the more your hemorrhoids are going to pop out, the more you're going to get sore. So, have your bowel movement, and then I obviously go back and listen to episode 1 about my feelings on wiping, but don't overwipe because that's what's really going to do it. That's what makes your butt raw is the wiping.
Yeah.
I tell people if you're sensitive, actually the days before, try to avoid acidic foods like spicy
Oh,
foods and tomato sauce and citrus because they can burn the butt. You remember, like, the old adage of like Taco Bell going out burns? you
Yeah.
know. So, the hot sauces, the spicy foods, Indian,
I
you know.
know. I know. I
I mean,
know.
I love me some tikka masala, but I'm not going to prep. I mean, I'm not going to eat that before my colonoscopy.
You know what I really like when you come to Cali? I'm going to take you to this joint in Pasadena. It's called Bone Kettle, and they've
Hmm.
got amazing bone broth soup. And it's a twofer because it's clear liquids, right? And then
Mm-hmm.
it's also great for the skin because it's a lot of
Collagen.
collagen.
Yeah.
But that's like a little treat. I'll give my like I'm all about treats right now. I need a lot of incentives. So I'll treat myself to bone broth from Bone Kettle the week of, and then I'll have a like celebratory meal after I finish my scope.
You're
Um,
such a Gen Z, Sonia. So
I
the
am.
Gen Zs are all about treats. That's how they
There's
just a
a
little
whole
treat.
there's a whole thing about treat culture that my friend who's a data strategist does, Annalisa, about the importance because people are looking for those small glimmers. You know, the opposite of triggers are glimmers, those micro moments of joy that take us back to childhood. So there's this whole thing about labuboos and all that
Laboo
stuff.
boobs.
So, there's another product.
Laboo
But
boob.
it's taking us somewhere. Like my sister's bought me 3 Trader Joe bags, like pink and orange and all these cute colors, and I'm putting patches on them just because with everything going on in the world, you just need a little tiny glimmer. Or like when I get to talk to you, I get a glimmer. When I see a hummingbird outside, I get a little glimmer, a little hit of
Ugh.
endorphins. So,
Hummingbirds? Ugh, I hate birds.
dude, hummingbirds are magical. They can like fly forward, backwards. They're magical
No.
creatures. Anyways, don't get me started on glimmers because as someone with an autoimmune 24/7, your energy levels wave in and out. You look for those micro moments of joy. But I digress. I will take you to Bone Kettle when you come and visit me. And then the drive. Okay, so I'm in LA. 405 South is not always the easiest like besides our airports, our hospitals. So sometimes can be an hour. Like I try to take the first appointment, and I'm hungry, I'm grumpy, and I'm tired because I wake up at 2 or 3 for my prep. Any tips on the drive over there as you're stuck in traffic or trying to just get to your destination?
No.
Okay,
It's
thank you.
there's nothing to make that better. I mean, you could
But I
also,
go ahead.
I mean, I would say like you don't have to. I actually, if when I get my colonoscopy, like I always choose 11 o'clock. I think that's the best time.
Because
Well, one, you get your second dose is at 5 a.m. So you don't have to wake up at like 2 in the morning. And, generally the 11 o'clock spot, they have you get there at 10. So, so that you have time to get ready and get the IV and get everything done. And so that means, like, even if you have to leave your house a little bit, you're kind of missing rush hour.
peak.
So you've missed the peak commute time. So generally
Yeah.
that's good. And then you're still like done by noon and all the good lunch places open. So I'm not like a huge breakfast person. And after like I'm starving. So I want like something of sustenance, like a big
Yeah.
sandwich, like dripping with turkey and cheese and mayo and all, and like a salad because I haven't eaten fiber. So nothing's open at that time. And I'm like, I can't even look at a scrambled egg and toast because I've eaten that for frickin' 4 days. So, anyway, I think 11 o'clock is the ideal spot. I hope everybody starts running for the 11 o'clock spot.
The only I did that once. The only challenge is if there's a complication with the patient before you, it you're in the waiting room for a bit longer, and you get hungry. But then once you get taken in, it's pretty cool for people that haven't done it yet. A lovely nurse, she, him come and greet you. They get the IV going, and you finally get some fluids in you, which is fun because you're kind of dehydrated and parched. You can't have water like what, an hour or two before the procedure? I
Two
can't remember.
hours, two,
Yeah.
two.
You can't have water, so you're parched. So I go from grumpy to glee because once that like tube comes in me, I'm like, I'm finally getting some nourishment. And then doctor comes, says hi. Anesthesiologist comes and says hi. You get wheeled in. The room is pumping. Everyone's on fire. Hi, hi, hi. Hi, Sonia. Hi, Sonia. Hi, Sonia. Like, music might or might not be happening. And then they roll you over on your left side, right, doc? Left side?
Left side.
Yeah, roll
Yep.
you over, and then they have you count to like backwards or something, and you're out. The propofol kicks in. And I woke up once to a conversation about baseball, and then they said, Sonia, go back to sleep. So I was like, hi. And they're like, go back to sleep, Sonia. I was like,
Down.
okay.
Back down.
Yeah, so what does propofol do? It's not the hard stuff. What is it?
It's something called MAC anesthesia. So it crosses the blood-brain barrier. So it puts you to sleep, but it doesn't affect your breathing. So you're still breathing on your own. So that's kind of like what we like about it. You don't need a breathing tube. You don't need to be intubated. You're still breathing on your own, but you're in la la land. You're in sleepy land.
Why do we feel so good?
Well, actually, propofol has like a mild euphoric effect. So
Oh.
it's kind of like you get a little euphoric after it. Although there is like a small subset of people that gets extremely emotional. And instead of euphoria, they're like hysterically crying after their colonoscopy. And I'm like, it's okay, it's normal, it's fine, it's just the anesthesia. So I'm like, it's okay. I'm sorry that you're not euphoric. Maybe it'll come later. But you can get emotional too.
But
It's fine.
they wake you up. So then after your procedure, they go click, 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 take a lot of pictures, lasso those polyps, get everything they need, and then you're wheeled back out.
Hmm.
And how long? Like it feels like an hour, but it's only like 30 minutes that I'm out.
Well, yeah, I mean, I tell people, like, let's say you have the 11 o'clock, right? Like, you get there at 10, like you said. You go back, we test most women for pregnancy, just to make sure. And then, you meet the anesthesia team, the nursing team. They go through your whole history. They ask you the same questions 55 times. You get an IV, you start getting rehydrated. And then, you go back in the room, you get the procedure. I'm like a militantly on time person. So if your procedure's at 11, you're wheeling back at 10:55. I guarantee it. And then, we do the colonoscopy or out the room around 11:20, 11, between 11:20, 11:25. And then usually what we do is we let you kind of wake up in that time period. We do another colonoscopy or scope after you, which is another 20 minutes. And then we're done around, 11:50, which is right around the 20-30 minute mark of you waking up. And we come out and you're awake and you're probably eating a snack that tastes like the best snack you ever had in your life, but
It's
it's
a very
really just like an old cookie or like a
yeah.
Lorna Doone shortbread.
And juice. I get some orange juice or something. And
Yeah.
I just want to give a shout out to the nurses. Like they just take such exquisite care of me.
Hmm.
And I know I'm a frequent flyer, but if you haven't done this before, please get your colonoscopy because it's a game changer. And always try to delight your doctors with fun socks or like like we talked about last time, a tattoo that says insert here.
Right. Yeah.
And then you
Just
come
remember
and
you can't
debrief.
drive that day.
Right. You need to
You gotta
have
drive
someone pick
yourself.
you up and drop you.
Hmm.
And then you all come and debrief
Yep.
and you tell us, here's what we saw on camera.
Yeah, I mean, most people give like a souvenir. I
Ooh,
like to
what?
say, yeah, like souvenir. You don't get photos. You don't get souvenir photos.
I get like a whole printout
Yeah,
aftercare.
come on, that's a souvenir. Might not be a Labubu, but it's still a souvenir. I like to tell people about, I'm always like, we have the same stupid jokes, right? Like I say the same jokes all the time, but like they're kind of funny. But I always say like, oh, you can start on your Christmas cards or whatever, with the pictures. And
Oh,
yeah, I see, it's funny. So one time I get and we all like take this picture of what's called retroflexion, where we like turn the scope upside down and we take a picture of like the internal anal canal, which is like the
yes.
where the hemorrhoids are and the bottom. And So it's like technically the inside of your asshole, right? And so I get this, it was maybe like it was December, and I get a postcard and it says like Merry Christmas. And it's somebody, it's a retroflex view of someone's butt. And I'm like, what the hell? And I turn it over and it says like Merry Christmas from your favorite asshole. And to this day, I don't think anybody's done anything as funny as that. Like, I was probably peeing my pants laughing so hard. Like, way to take what I said literally, but also like take it to the next level. Like, seriously, make me a Christmas card of your butt and say, love your favorite asshole. Like, it doesn't get much better than that for a
That's
gastroenterologist.
a
Like,
queer.
top tier.
Did you ever watch Meet the Fockers?
Uh huh. Uh huh.
The little kid learns asshole,
Mm hmm. Uh huh.
asshole. Yeah. Okay. I don't know why I came up with that. Dr. Soy, I think we're at time. I just wanted to say thank you. A shout out to Scrubs and Heels too, which is where Dr. Soika and I fell in love. And my sticker today is, did you ever watch Die Hard?
I can't really see it.
Well,
You're in the filter. It's not picking
well,
it up.
okay. Well, my sticker today says yippee-ki-yay, motherfuckers. So, I'll send it to you. Too bad you can't see it. But yeah,
Hopefully people like our cursing.
yeah. Well,
If
sentence
you don't,
enhancers. Sentence
yeah.
enhancers is what I call them. Um,
Sentence
but
enhancer.
I love you. I'll talk to you next week, and thank you for joining us.